Hello everyone, welcome back to the 500 MCQ series of Drug Inspector exam. So today we will be discussing the question number from 36 to 40. So the first question of the day, aprepitant is used as A choice anti-emetic agent, B choice gastric antacid, C choice proton pump inhibitor, D choice emetic, E choice appetizer. So the word pitant, you need to remember the word pitant. P-I-T and pitant. So the important drugs are aprepitant, rolapitant, natopitant, casopitant. So these pitant drugs belongs to a category called as neurokinin 1 antagonist. So all these pitant drug belongs to the category neurokinin 1 antagonist or simply NK1 antagonist. NK1 antagonist. And what is the use of these drugs? So they are basically used in the case of for treating the chemotherapy induced vomiting. Chemotherapy induced vomiting. The second use is that it is used in the case of radiotherapy induced vomiting. It is also used in the case of post-operative nausea and vomiting. So these pitant drugs are neurokinin antagonist used for in the chemotherapy induced vomiting or radiotherapy induced vomiting as well as post-operative nausea and vomiting. If you remember the citrone drugs, for example, ondansetron, palonosetron, these citrone drugs, ondansetron, palonosetron, granisetron. So these are the drugs which belongs to the category 5-HT3 antagonist or serotonin antagonist. In fact, these citrone drugs are the drug of choice. These drugs are the drug of choice in the case of chemotherapy-induced vomiting, radiotherapy-induced vomiting, as well as the post-operative nausea and vomiting. So the citrone drugs are the drug of choice. However, the neurokinin antagonist can also be used in chemotherapy-induced vomiting as well as the radiotherapy-induced vomiting. Okay. So here basically this drug aprepitant is an anti-emetic agent. So the correct answer would be definitely A choice. Let's move on to the next question. Which of the following is a selective alpha 2 blocker and selective beta 2 blocker respectively? Okay. So the first thing we know that these receptors alpha and beta, these are the two important receptors in the adrenergic system, alpha and beta. Among alpha there are two important receptors, that is alpha 1 and alpha 2. Among beta 1 there are three receptors, beta 1, beta 2 and beta 3. The most important ones are beta 1 and beta 2. Now here the question was which is an antagonist or a blocker for these receptors. So let's come to the first one, that is the alpha blockers. So we know that alpha receptors are of two types, that is the alpha 1 receptors and alpha 2 receptors, alpha 1 and alpha 2. So we can block it in three different ways. So the number one, we can either block both the alpha 1, that is alpha 1 and alpha 2 blocker. So alpha 1 and alpha 2 blocker, they are called as non-selective alpha blocker. Non-selective alpha blocker. The second strategy is that we can specifically or selectively block alpha 1 receptor. They are called as alpha 1 blocker or selective alpha 1 blocker. The third strategy is we can specifically or selectively block alpha 2 receptor. They are called as selective alpha 2 blocker. So this is the three classification coming under the alpha blocker category: non-selective alpha blocker, selective alpha 1 blocker, and selective alpha 2 blocker. You need to remember the drugs coming under each category. So among the non-selective alpha blocker, the important drugs are phenoxybenzamin, Another example is phentolamine. Phentolamine is a non-selective alpha blocker. Another example is tolazoline. Also, the ergot alkaloids belongs to non-selective alpha blocker. The important examples in ergot alkaloids are ergotamine. So phenoxybenzamin, phentolamine, tolazoline, and ergot alkaloid belongs to the non-selective alpha blocker. Now coming to the example for selective alpha 1 blocker, you need to remember the suffix zosine. The important examples are prazosin, terazocin, doxazocin, alfusocin. So the name of these drugs ends with the zocin. They belongs to the selective alpha 1 blocker category. Also one more example you need to remember, tamsulosin. Tamsulosin is also a selective alpha 1 blocker. Now coming to the selective alpha 2 blocker, you need to remember one example. The example is yohimpine. So yohimpine is the selective alpha 2 blocker. This was one of the questions. So selective alpha 2 blocker, the example is yohimpine. Now coming to the beta blocker category. So we know that beta blocker, coming to the beta blocker, we have mainly two receptors, beta 1 and beta 2. So beta 1 is important and beta 2 is also important. So we can again block these drugs into three categories. One is we can block both the beta 1 receptor and the beta 2 receptor. So if we block both beta 1 and beta 2, we can call it as a non-selective beta blocker. Non-selective beta blocker. The second strategy is to specifically block beta 1. So we can call it a selective beta 1 blocker. We can specifically block beta 1 receptor. So they are called as selective beta 1 blocker. If you remember, beta 1 is present in the heart. So if we selectively block beta 1 receptor, it is also called as cardioselective beta blocker. So cardioselective beta blocker is nothing but the cardioselective beta blocker. It is nothing but the selective beta 1 blocker is called as cardioselective beta blocker. Now the third one is that we can selectively block beta 2 receptor. So they are called as selective beta 2 blocker. Now let's look into the examples of each of these drugs. Now coming to the non-selective beta blocker, you know the common drugs. Propranolol is a non-selective beta blocker. Pindalol, sotalol, timolol, and nadolol. So these are the important drugs which comes under the non-selective beta blocker category. Now coming to the selective or cardioselective beta 1 blocker, the examples include atenolol, metoprolol, esmolol, acebutolol, betaxolol, nebivolol, and bisoprolol. So these are the drugs which are selective beta 1 blocker. Now coming to the selective beta 2 blocker, you need to remember one example, that is butoxamine. So butoxamine belongs to selective beta 2 blocker. So this was the second part of the question, selective beta 2 blocker. Selective alpha 1 blocker was yohimbine. So the correct answer for this question is selective alpha 2 blocker is definitely yohimbine, and selective beta 2 blocker is butoxamine. So the correct answer for this question would be A choice. Let's move on to the third question of the day. Question is lactulose. Lactulose is A choice, osmotic laxative, bulk laxative, stimulant purgatives, stool softeners, and none of the above. So for the first thing you need to know, laxative, the other names of laxatives. So laxatives are also called as aperients. The synonyms of laxatives are aperients. It is also called as purgatives. Laxatives are also called as cathartics. So the minor difference in these terms are, if the action is milder, if the laxative action is milder, it's better to call laxative or aperients. So laxatives and aperients have milder action, milder laxative action. If the laxative action is very strong, then it's better to call it as purgative or cathartics. So purgatives and cathartics have stronger laxative action. Okay, so this is the primary difference between these four terminologies. Now we can divide this laxative into four categories. So you can remember this mnemonics, BOSE. So coming to the classification of laxative, you can remember the mnemonic BOSE. B stands for bulk laxative. O stands for osmotic laxative. S stands for stimulant laxative, or purgative, stimulant laxative, and the second S stands for stool softeners. Okay, so this is the main four subgroups coming under the laxative category: BOSE, bulk laxative, osmotic laxative, stimulant laxative or purgative, and the fourth one is stool softeners. Now coming to the examples of each of this, let's take the first one, that is the bulk laxative. So the examples for bulk laxative, you can just remember the word BD. So D stands for dietary fibers. So the examples for bulk laxatives are dietary fibers. Among dietary fibers, the examples include bran, psyllium. Psyllium comes from the plantago seeds, psyllium also called as plantago, isfagula, methyl cellulose or methyl cellulose. So these are the dietary fiber category. So these are bulk laxative. Now coming to the osmotic laxative. So the second category is osmotic laxative. So you can remember the mnemonic OLS, osmotic laxative, OLS. L stands for lactulose. Lactulose is an osmotic laxative. S stands for saline laxative or saline purgatives. Saline purgatives, and the examples for saline purgatives include magnesium sulfate, the molecular formula is MgSO4, magnesium hydroxide, the molecular formula is MgOH twice, sodium sulfate, the molecular formula is Na2SO4. One more example you can remember, sodium phosphate, Na3PO4. So these are examples for saline purgatives, and lactulose and these saline purgatives are example for osmotic laxative. Now coming to the examples for stimulant purgatives. Stimulant purgatives. You can remember stimulant purgatives S. You can remember SC, SCS. Okay. So C stands for, the first C stands for castor oil. Castor oil. This S stands for senna. Again the C stands for cascara. Another S stands for sagrada. So among this, the castor oil is basically a fixed oil, whereas senna, cascara and sagrada belongs to the anthraquinone glycosides, anthraquinone groups. Okay, so you can remember SC, SCS. Okay. Apart from this, the other drugs are, one is bisaccordyle, sodium picosulfate, phenolphthalein, and prucalopride. So these are the other examples for the stimulant purgatives. Among this, the bisaccordyle, sodium picosulfate and phenolphthalein, they are organic compounds. They are organic compounds. And the mechanism of action of prucalopride, you can remember, it is a 5-HT4 agonist. 5-HT4 is serotonin, 5-HT4 agonist. Okay, so these are the examples for stimulant purgatives. Now moving to the stool softeners. Stool softeners. The examples are DOS, DOSS, also called as docusate. DOS is the abbreviated form of docusate. The chemical name is dioctyl sodium sulfosuccinate. Dioctyl sodium sulfosuccinate. So this is abbreviated as DOS. DOSS. Okay, DOS. Dioctyl sodium sulfosuccinate. Okay. Now another example is liquid paraffin. That is also a stool softener, which is not used nowadays, not preferred nowadays. However, DOS and liquid paraffin, they are actually stool softeners. Okay. So here the question was lactulose. So the answer is osmotic laxative, A choice. Let's move on to the next question of the day, that is 39. Which of the following indicator has pH range of 8.3 to 11? A choice methyl orange, B choice methyl red, C choice litmus, D choice HPH, HPH is phenolphthalein, E choice alizarin yellow. Okay, so this 5 indicators which are commonly used in the acid base titration, you need to remember the pH range and what is the color on the acidic medium and what is the color on the basic medium. It's better to remember this 5 indicators. This has been asked in the previous drug inspector exam. So let's look into the first range of this methyl orange. So the pH range of methyl orange is 3.1 to 4.4, whereas methyl red or methyl red, the pH range is 4.4 to 6.2, whereas litmus paper we all know, so the pH range is 5 to 8. Phenolphthalein, abbreviated as HPH, the pH range is 8.3 to 11, whereas alizarin yellow, the pH range is 10 to 12. Okay, now coming to the methyl orange indicator, the color on the acidic medium, yes, it is red. it is red in color in the acidic medium, whereas in the basic medium it is yellow. It is yellow colored. Okay. Now methyl red again, in the acidic medium it is red, whereas in the basic medium it is yellow. Now coming to the litmus, we know that litmus in the acidic medium it is red only, it is red, whereas in the basic medium it is blue. The color change will be blue. Now coming to phenolphthalein, in phenolphthalein in the acidic medium it is colorless, whereas in the basic medium it will give pink color. Okay. Now alizarin yellow, in the acidic medium it is yellow, whereas in the basic medium it is red. So you better remember these 4 indicators: methyl orange, methyl red, litmus, phenolphthalein, alizarin yellow, the pH range of it, and what is the color on the acidic medium and the color on the basic medium. So here the question was which of the following indicator has a pH range 8.3 to 11. The correct answer would be definitely phenolphthalein. The abbreviation is HPH, so the answer would be D choice. Now moving to the last question of the day, the glomerular filtration rate, okay, abbreviated as in an adult with normal kidney function. That was the question. So glomerular filtration rate abbreviated as GFR. Okay, so it tells how well your kidney is working. Okay, so ideally it is saying it should be more than 90 to 100 in a normal kidney functioning person. It should be more than 90 to 100 ml per minute. Specifically telling the value is 125 ml per minute is considered to be the glomerular filtration rate. If the value comes below 90, that indicates that kidney is having certain damage or the kidney related issues are there. If the GFR is less than 90, so the ideal value is 125 ml per minute. Okay, so the nearest value here given is B choice, 120 ml per minute. Now sometimes this question will the unit will be given in days or liters per day, so then the answer would be 180 liters per day. That means in one day 180 liters of the fluids are getting filtrated in the glomerular. So the GFR rate in one day it is 180 liters per day, where if the unit is in ml per minute, the answer would be 125. Okay, so that's all. Hope you understood this discussion. Keep on watching. Thank you.